Alkaline phosphatase, often abbreviated as ALP, is an important enzyme found throughout the human body. Its primary function is to catalyze, or speed up, specific chemical reactions, helping maintain various physiological processes. Although ALP is present in all body tissues, the highest concentrations are typically observed in the liver, bile ducts, and bones. Each of these locations produces a slightly different form of ALP, known as isoenzymes. An alkaline phosphatase test is a laboratory blood test that measures the amount of ALP circulating in the bloodstream. Healthcare professionals use this test as a tool to screen for, help diagnose, or monitor diseases primarily affecting the liver or bones. However, ALP levels can also be influenced by other conditions, including diseases of the kidneys and certain gastrointestinal ailments. There are several reasons why a healthcare provider might order an alkaline phosphatase test. Sometimes it is included as part of a routine health checkup, especially since a wide array of medical conditions can impact ALP levels. It is common for this test to be performed alongside other blood tests, such as a comprehensive metabolic panel, CMP, or specialized liver function tests. These combinations provide a more complete picture of a patient's health, particularly the functioning of the liver and metabolic system. The ALP test is also indicated when a person exhibits symptoms that suggest possible liver damage or a bone disorder. Symptoms of liver disease can be varied, ranging from nausea and vomiting, loss of appetite, and persistent fatigue, to more specific signs like jaundice, a yellowing of the skin and eyes, swelling and pain in the abdomen, swelling in the ankles and legs, dark urine, pale stools, and frequent episodes of itching. On the other hand, symptoms that might point to a bone disorder include persistent bone pain, swelling and arthritis in the joints, abnormal bone shape or size, and an increased tendency to suffer bone fractures. The process of undergoing an alkaline phosphatase test is straightforward and minimally invasive. A healthcare professional draws a small blood sample from a vein, typically in the arm. The procedure takes only a few minutes and may cause minor discomfort, such as a brief sting or a small bruise at the puncture site. But these symptoms resolve quickly. Preparation for the test depends on the specific instructions from the healthcare provider. Because the ALP test is often performed with other blood tests, fasting, meaning not eating or drinking for several hours, may be required. Patients might also need to temporarily stop taking certain medications, but it is crucial to follow the provider's guidance and not discontinue any prescribed drugs without medical advice. The results of an alkaline phosphatase test can yield valuable clues about a person's health, but they must be interpreted in context. High ALP levels are often indicative of a problem in the liver or bones, but the test cannot specify which type of ALP is elevated or the exact source. To pinpoint the origin, further testing may be necessary, such as an ALP isoenzyme test, which distinguishes between the different forms of ALP and thereby identifies the tissue of origin. Additional liver function tests may also be used. If these are also elevated, the problem is likely in the liver. Elevated ALP levels due to liver issues might signal conditions such as bile duct blockages, cirrhosis, scarring of the liver, hepatitis, liver inflammation, or, less commonly, infectious mononucleosis, which can cause liver swelling. If the ALP is high but liver function is otherwise normal, a bone disorder may be considered. For example, Paget's disease of bone, a condition characterized by enlarged and weakened bones, often leads to elevated ALP. Moderately increased ALP levels may be associated with a broader range of conditions, including Hodgkin lymphoma, heart failure, and certain infections. However, it is possible for some individuals to have higher than normal ALP levels without any underlying disease requiring treatment. In such cases, healthcare professionals take into account the patient's symptoms, medical history, and the results of other tests before making a diagnosis. Conversely, low levels of alkaline phosphatase are less common, but can also provide important diagnostic information. Low ALP might suggest a deficiency of zinc or protein, malnutrition, pernicious anemia, thyroid disease, Wilson disease, a rare inherited disorder involving copper buildup, or hypophosphatasia, a rare genetic condition that affects bone and dental health. It is important to recognize that many factors can influence ALP levels. For example, pregnancy naturally raises ALP concentrations, as does normal bone growth in children and teenagers. Certain medications, like birth control pills, can also impact ALP measurements, sometimes leading to lower values. Because ALP is a non-specific marker, an abnormal result does not automatically mean a person has a serious health problem. Instead, it serves as a signal for healthcare providers to look more closely for potential issues, using additional tests and clinical evaluation to make an accurate diagnosis. In summary, the alkaline phosphatase test is a valuable tool in modern medicine, allowing clinicians to screen for, diagnose, and monitor diseases of the liver and bones, among other conditions. Its results, while informative, should always be interpreted in conjunction with other laboratory findings, the patient's symptoms, and their overall health status. Understanding what ALP is, why its levels are measured, and what abnormal results might mean can empower individuals to participate more actively in their healthcare and to discuss any concerns or questions with their medical providers. As always, if you or someone you know has concerns about liver or bone health, or if you have questions about your lab test results, it is important to consult with a qualified healthcare professional for guidance tailored to your specific situation. Staying informed and proactive is a crucial part of maintaining health and well-being.